of course, we're all spending more time at home these days. And if you're having some problems with your significant other in the bedroom, well, guess what? We've got a solution for you. Now, this interview was done before social distancing, but they are still open by appointment only. Here's Wasatch Medical. And spring is here, and that means transformation. The temperatures are getting warmer outside, and guess what? They're getting warmer in the bedroom too. Yes, they are. We are talking all about erectile dysfunction. I know it's a touchy subject, and that's why we're helping you out, though, to get the conversation started for those of you that may be struggling. Yeah. Andrew Reinhardt here with Wasatch Medical Clinic. Andrew, thank you so much. We get you on the show every couple of weeks, which I think people are starting to recognize your face.
They
so
are.
Some may know you're the guy. Others may not have a clue what we're talking about. So let's tell them.
Well, and when it comes to ED, it's a sensitive subject, like you mentioned. And some people kind of say, oh, I'm not going to talk about that. And what happens is the condition goes untreated. And so nothing happens. The ED gets worse. The relationships are damaged. It affects the guy, of course, but it affects the relationship.
Oh, 100%.
So if you are the female or the partner out there watching, you're probably affected by erectile dysfunction as well.
Do you feel like in today's world, we're living in a society where social media is making it more acceptable to talk about those touchy subjects, this being one of them, and I think it's so great that we all get the conversation started. So let's talk about, like you said, there hasn't been a great solution besides the pill, which is so many side effects until
acoustic wave therapy. This is the first and only thing that addresses the root cause problem of ED. Blood vessels shrivel up and die as a man ages. The American diet and lifestyle don't help us. And so you kind of is a plumbing issue if you think about it. This opens up and regrows blood vessels. It's a process called neovascularization. There have been so many clinical studies done now. The FDA cleared this technology in 2011, so 9 or 10 years now. And every week I see new studies. One that came out from Cambridge showing that this has an 87% success rate in reversing ED. That means restore the spontaneity. Yeah, it is great. 87%. In the medical world, that's very high.
That's huge.
It is.
Now, it's non-invasive, and it's very easy. Some people may only have to do a couple treatments. Some could continue to go constantly, right?
That's about right. It depends on your medical history. Typically, though, 2 to 3 weeks of treatments, once or twice a week, 10 minutes per treatment, that's it. You're done. You think about the pill, you're taking that for life. This is something that you will do, and then you can stop. Another study, I'm talking about studies today, 3 years down the road, 92% still had the same effect.
Wow. And it's something so simple, so easy. In talking to Andrew, over the last few months, I asked him one time, I said, is it busy? Are there a lot of people there? Does the partner come with the person? And you said,
you come
basically it's out the door.
Right. You come into our waiting room, and the first thing guys say is, I can't believe how many spouses are here. Because, and I love to see that, by the way, the communication, it's a joint decision, and I love to see them tackle the problem together.
100%. Now let's talk about feedback. What are you hearing, and what are the ages of people that you're hearing
This is a great question. A lot of guys think they're too young to have this problem. There is not a day that goes by that I don't see somebody in their 20s and 30s.
Wow.
Every day. And then I'll go into the next room, and it'll be a guy in his 90s. We had a 76-year-old patient in a couple weeks ago, had ED for 10 years. The pills didn't work. The injections didn't work. He was 1 week into our treatments and told us it was the only thing to ever work.
After
76 years old.
After 1 week. Talk about a rough 10 years.
Yeah.
I mean, that's really, really hard, but what a great thing for him to discover this and finally get back to feeling like himself again.
Yeah, and 1 week, that's pretty quick. We're talking maybe into the first week of April, you guys could be back to normal.
So it's all about spring, people. We're transforming you. We're getting you back to normal. We're going to get things back to normal in the bedroom. So tell them about your special offer.
Yes, so many guys out there struggling in silence. Call us now. We're going to make it so easy. The initial assessment, medical exam, a blood flow ultrasound. You'll be able to hear your blood flow.
Wow.
Totally free. Yeah, it's really cool. That's with a medical doctor. Get started on our treatments. We'll give you a special gift that produces instant results in the bedroom. So give us a call now.
I love it. All right. You can also go to the website for more information. Andrew, always good to see you. Thank you so much.
Appreciate it.